Welcome back. Today we are going to discuss about osteoporosis disease. Osteoporosis, which is also called brittle bone disease or porous bone disease, is a medical condition in which the bones become weak and brittle and make them more likely to break. This happens when the body loses too much bone tissues, makes too little bone tissues, or both. Osteoporosis can affect any bone of the body, but the most commonly affected bones are the hip, spine, and wrist. It is more common in women than men. The risk of developing osteoporosis increases with age. Osteoporosis is called a silent disease because people who may develop it may not notice any changes until a bone breaks. Bones are made of living tissues. To keep them strong, a healthy human body breaks old bones and replaces it with new bones. Osteoporosis develops when more bone is broken down than replaced. The inside of a bone looks like something like a honeycomb. When someone has osteoporosis, the bone which forms the wall of the honeycomb gets smaller and the spaces between the bone grew longer. The outer shell of the bone also gets thinner. All of this makes a bone weaker. In serious cases of osteoporosis, a simple motion such as cuff or minor bump can result in a broken bone, also called fracture. People with osteoporosis also have a harder time recovering from broken bones. Symptoms of osteoporosis. As I already said that osteoporosis is called a silent disease because there are typically no symptoms until a bone breaks. Symptoms of spine fracture include severe back pain, loss of height, or spine malformations such as stooped or hunched posture. Bones affected by osteoporosis may become so fragile that fractures occur spontaneously or as a result of minor falls, such as a fall from standing height that would not normally cause a break in a healthy bone. Normal stress, such as bending, lifting, or even cuffing. Causes of osteoporosis. Osteoporosis is caused by a loss of bone density, which can be due to the factors such as aging, hormonal changes, and certain medications. Other causes of osteoporosis include a lack of calcium and vitamin D in the diet, a sedentary lifestyle, smoking, and excessive alcohol consumption. Medical conditions that can cause osteoporosis include hypothyroidism, inflammatory bowel disease, and rheumatoid arthritis. Some medications can also cause bone loss, including corticosteroids, thyroid hormone replacement, and certain anticonvulsants. Risk factors related with osteoporosis. Many factors can cause to develop the risk of osteoporosis, including your age, race, lifestyle choices, and medical conditions. There are some risk factors of osteoporosis on which you have no control, such as your sex. Women are much more likely to develop osteoporosis than men. Age. As you get older, your risk of osteoporosis also increases. Having a parent or sibling with osteoporosis increases your risk of developing osteoporosis, especially if your mother or father fractured a hip. If you have a small body frame, you are at a higher risk of osteoporosis. Hormone levels. Osteoporosis is more common in people who have too much or too little of certain hormones in their body, such as lower sex hormone levels tend to weaken bone. The fall of estrogen level in women at menopause is one of the biggest risk factors for developing osteoporosis disease. treatment for prostate cancer that reduces testosterone levels in men, and treatments for breast cancer that reduces estrogen level in women can increase the risk of bone loss. Thyroid problems. Too much thyroid hormone can cause bone loss. This happens if your thyroid is overactive or you take too much thyroid hormone medications to treat an underactive thyroid. Calcium deficiency also plays a vital role in the development of osteoporosis. Low calcium intake contributes to diminished bone density, early bone loss, and an increased risk of fractures. Being overweight also weakens bones in both men and women. Medical conditions. The risk of osteoporosis is higher in people who have certain medical problems, including celiac disease, inflammatory bowel disease, kidney or liver disease, cancer, multiple myeloma, rheumatoid arthritis. Sedentary lifestyle. People who spend a lot of time sitting have a higher risk of osteoporosis than the people who remain active. Weightlifting exercises that promote balance and good posture are beneficial for the bones. Excessive alcohol consumption. Regular consumption of more than 2 alcoholic drinks a day increases the risk of osteoporosis. Treatment for osteoporosis. The most aggressive way to prevent osteoporosis is to take prescription medications such as bisphosphonates. Bisphosphonates are a class of drugs that are used to treat osteoporosis, Paget's disease, and other bone disorders. They work by slowing down the rate of bone loss, which helps to reduce the risk of fractures. Bisphosphonates are usually taken orally or by injections. Some common examples of bisphosphonate include alendronate, ibandronate, and zoledronate acid. However, bisphosphonates can have side effects. So it is important to talk to your doctor about whether they are right for you or not. Antibody. There are two antibody drugs in the market, denosumab and romosozumab. Denosumab works by slowing down the rate of bone loss and reducing the risk of fractures. Denosumab is usually given as an injection under the skin. Before using denosumab, talk to your doctor. Romosozumab. Romosozumab is a medicine used to treat osteoporosis in women who have gone through menopause and are at high risk of fracture. It works by increasing bone formation and decreasing bone resorption. Romosozumab is usually given as an injection under the skin. Calcium and vitamin D. Calcium and vitamin D are important for maintaining strong bones. But if you are not getting enough calcium and vitamin D, it can increase your risk of osteoporosis. Calcium is needed to build and maintain strong bones, while vitamin D helps your body to absorb calcium. Without enough calcium and vitamin D, your body may start to take calcium from your bones, which can lead to bone loss and increases the risk of fractures. This is why it is important to take enough calcium and vitamin D through diet and supplements. It's all about osteoporosis disease. If you have any question or query, you can ask in the comment section below. Goodbye.